1. Which of the following is the primary goal of adult learning principles in a recovery support setting? A. To enhance motivation through external rewards. E. To focus solely on memorization and recall. C. To engage learners in problem solving and critical thinking. D. To discourage group work and collaboration. 2. What is the best method for evaluating the effectiveness of a recovery program? Relying solely on self-report from clients. E. Monitoring progress through objective and subjective measures. C. Ignoring feedback from clients and staff. D. Focusing only on the number of participants. 3. When designing a curriculum for a recovery program, which of the following is most important? Ensuring the curriculum follows a rigid structure without flexibility. B. Incorporating the diverse learning styles of participants. C. Limiting the involvement of peers in the learning process. D. Minimizing group activities and focusing on individual tasks. 4. What is the primary role of a recovery support specialist in mentoring individuals in recovery? A. To enforce rigid behavioral rules. B. To guide and empower individuals to make their own decisions. C. To provide therapy in place of licensed professionals. D. To monitor clients constantly for rule violations. 5. In communication with individuals in recovery, which technique is considered most effective? A. Using jargon to demonstrate authority. B. Speaking in a directive and authoritarian tone. C. Active listening and providing empathetic responses. Avoiding eye contact to maintain authority. 6. Which of the following best reflects a culturally competent approach in recovery support? A. Treating all clients the same, regardless of cultural background. B. Recognizing and respecting the unique cultural contexts and needs of each individual. C. Enforcing a one-size-fits-all approach to recovery. D. Focusing solely on the most common cultural norms. 7. What is the primary purpose of incorporating peer support in recovery programs? A. To provide therapy without the need for professional supervision. B. To offer clients a chance to interact with others who share similar experiences. C. To give clients a platform to criticize professionals. D. To have peers take over the role of support specialists. 8. Which evaluation method is most suitable for assessing long-term recovery outcomes? Immediate feedback surveys from clients. B. Periodic follow-ups and reassessments at regular intervals. C. One-time evaluation at the beginning of the program. D. Relying on family members' observations only. 9. When developing a curriculum for a recovery program, how can adult learning principles best be applied? A. By providing lectures without interactive activities. B. By allowing flexibility and encouraging learner-centered approaches. C. By focusing exclusively on theoretical knowledge. D. By avoiding real-life scenarios and lessons. 10. Which of the following is an essential aspect of regulatory compliance in recovery programs? A. Ensuring that all program materials are written in technical language. B. Complying with state and federal guidelines and maintaining proper documentation. C. Ignoring client confidentiality to streamline processes. D. Prioritizing cost-cutting measures over compliance. 11. Which communication strategy is most effective when working with individuals from diverse backgrounds in recovery? A. Using standardized communication for all clients. B. Customizing communication based on individual needs and cultural backgrounds. C. Relying solely on written communication. D. Speaking only in formal, authoritative tones. 12. How can a recovery support specialist best foster a collaborative environment in group settings? A. By taking control of all discussions. By facilitating open dialogue and ensuring every voice is heard. C. By limiting interaction between participants. D. By avoiding the use of group activities. 13. Which of the following is a key challenge when mentoring individuals in recovery? A. Ensuring all participants follow the same recovery path. B. Balancing empathy with maintaining appropriate professional boundaries. C. Focusing only on the individual's past history. D. Encouraging clients to disregard professional guidance. 14. What is the primary reason for using self-assessment tools in a recovery program? A. To assign blame for past failures. E. To help clients reflect on their progress and set goals for improvement. C. To replace professional evaluations. D. To ensure clients are solely responsible for their recovery. 15. What is the most important consideration when adapting curriculum content for adults in recovery? A. Reducing content complexity to a minimum. B. Ensuring the content is relevant, practical, and engaging for adults with real-life experiences. C. Focusing entirely on theoretical concepts. D. Keeping lessons short and minimal to avoid overwhelming clients. 16. Which of the following is the most effective way to ensure that recovery support specialists maintain professional development? A. Attending annual conferences without follow-up actions. B. Participating in ongoing training, supervision, and reflective practices. C. Relying on previous training and avoiding new learning opportunities. D. Delegating all responsibilities to administrative staff. 17. In a recovery support program, what role does feedback play in the evaluation process? It serves as a way to penalize individuals for mistakes. B. It is used to gauge participants' satisfaction without addressing underlying issues. It helps identify areas of improvement and reinforces positive behaviors. D. It is irrelevant in an evidence-based approach to recovery. 18. When implementing a recovery program, which of the following is an essential component for success? A. A rigid, unchanging curriculum. B. A flexible, client-centered approach that adapts to individual needs. C. Ignoring the importance of family involvement. D. Focusing solely on physical aspects of recovery. 19. Which strategy is most effective for fostering empowerment in clients during their recovery journey? A. Providing clients with step-by-step instructions without room for decision-making. B. Encouraging clients to make their own informed choices and fostering self-efficacy. C. Encouraging clients to follow others' decisions for better results. D. Making decisions on behalf of the client to speed up the process. 20. How can a recovery support specialist best support individuals during a crisis situation? A. By maintaining a professional distance and avoiding involvement. By offering immediate solutions without involving the client in the process. C. By remaining calm, offering emotional support, and involving appropriate resources. D. By encouraging clients to handle crises on their own. 21. Which adult learning principle is most important when working with individuals in recovery? A. Focus on rote memorization of treatment plans. B. Engage participants in problem-solving, critical thinking, and real-life application. C. Minimize active participation to maintain control of the session. D. Prioritize lectures over experiential learning. 22. What is an important consideration when providing feedback to clients in recovery? A. Providing only positive reinforcement regardless of progress. B. Delivering constructive criticism in a supportive and non-judgmental manner. C. Avoiding feedback to prevent overwhelming the client. D. Focusing only on clients' weaknesses and failures. 23. How can recovery support specialists promote effective communication in group sessions? A. By limiting interaction to avoid distractions. By fostering an environment of openness, respect, and active listening. C. By maintaining a strict, authoritarian tone during discussions. D. By avoiding group discussions altogether. 24. Which of the following is the most appropriate action when a client is resistant to participating in recovery activities? Forcing participation to ensure compliance. B. Using empathy to understand the client's concerns and gently encouraging participation. C. Ignoring the resistance and continuing with the program. D. Confronting the client aggressively about their lack of participation. 25. What is the best way to support clients' ongoing recovery after they complete a program? A. Offering a one-time follow-up phone call to check in. B. Providing continuous support through aftercare services, peer support, and ongoing resources. C. Discontinuing all communication after the program ends. D. Encouraging clients to rely solely on family support for recovery. 26. When is it appropriate to introduce new learning techniques in a recovery program? At the very beginning of the program to immediately engage participants. B. After establishing a foundation of trust and understanding among participants. C. After the first month of the program to assess progress. D. When there is a lack of interest in the existing material. 27. How can recovery support specialists best engage clients in the goal-setting process? A. By setting all goals for the clients to follow. B. By providing clients with autonomy to set their own realistic, measurable goals. C. By discouraging goal setting to avoid disappointment. D. By only setting short-term goals for immediate results.